Hi, I'm Melissa from ConnectMed. Over the past 5 years, I've worked in Zambia, Nigeria, South Africa, Ghana, and Kenya. In each of these countries, I met so many people who'd experienced health tragedies in their lives. Kelvin's sister had died of diarrheal disease. Susan's uncle had gone blind from diabetes, and Wenda's mother had just passed away from tuberculosis. All of these tragedies could have been prevented with access to basic primary health care. So why aren't people getting the care that they need? Let's take Fabian, a receptionist I met working in Nairobi. When Fabian falls sick, she, like 80% of the population, can't afford quality private care. And to see a public doctor, she has to travel 2 hours in congested traffic and queue for over 4 hours, losing an entire day's income. This situation exists because there's an extreme shortage of healthcare workers in Africa. Not enough to support the kind of delivery model we use in high-income countries. At ConnectMed, we believe there's a solution. Healthcare is increasingly becoming digital. Last year in the UK, there were over 2 million online consultations. By 2030, 30% of all doctor-patient interactions will happen online. Healthcare systems that are centralized and infrastructure-heavy are no longer necessary. With digital technologies, we can build a health system that is distributed, lightweight, and requires significantly fewer healthcare workers. At ConnectMed, we do this by transforming local pharmacies into virtual microclinics. Now, when Fabian falls sick, she can just walk to her local pharmacy minutes away, video consult the right healthcare professional for her, and receive tests on the spot, all at a fraction of the cost and time of other options. We're harnessing telehealth technology, point-of-care diagnostics, and machine learning to better harness and distribute medical knowledge through a lightweight channel. In our 5 initial markets, there's a $3 billion opportunity to provide quality primary healthcare. And it's rapidly expanding as Africa houses the world's fastest growing population. And we're already well on our way to achieving our mission. In Kenya, we've already launched operations in 10 pharmacies, recruited 50 doctors, and served over 500 patients. We've also partnered with the Abraj Group to service 10,000 of their patients through our model. We've proven that it takes just 2 months to pay back the kiosk costs, and we make 25% margin per consult. I spent the last 2 years researching African healthcare delivery during my master's in computer science and MBA at Oxford on a Rhodes Scholarship. I've also spent over 5 years working as an engineer, entrepreneur, and consultant in Africa and Latin America. When I came to EF, I met my co-founder, Chris, who had just left Palantir, where he led their anti-human trafficking project. His 6 years of experience in consumer software and data engineering are pivotal to scaling our solution across Africa. We're raising £500,000 to expand our business in Kenya and start operations in South Africa and Nigeria, where we already have strong relationships. Join us. Together, we can leapfrog traditional healthcare delivery and change the fate of an entire continent. Thank you.